Hello, everyone. Thanks for joining us on the news briefing for this Wednesday. I am just checking our participants, and I'm wondering if we have Dr. Sakai on the Zoom. I am not seeing Dr. Sakai just yet, but I do see, I saw we had Kristy Michie on. There she is. Kristy, in the interest of time, would you be willing to launch us with our COVID-19 information?
Yes, although I see she just joined. Maya, would you like?
Sure. Oh, there you go. Hello, Dr. Sakai. We were just collecting all of our participants today. Very pleased to have you here. Let me just give you just a brief introduction. As many people know, COVID vaccine for children ages 6 months to 4 years is now available. And there are a lot of questions that parents may have about the vaccine. And we're very pleased to have Dr. Reiko Sakai, who is a pediatrician from Natividad, to join us today to talk about this. Good afternoon.
Yes, hi, thank you. Can you guys hear me okay? Sorry for that.
So Dr. Sakai, can you tell us a little bit about the vaccine and perhaps what parents are asking you about it?
Yes, so, and just to confirm, everyone can hear me okay? Okay,
we got you.
Yes, so it's a very exciting time for those of us as providers and caregivers of young children now that we have FDA emergency use authorization, CDC, and American Academy of Pediatrics recommendations, as well as local agencies approving both the Moderna and Pfizer vaccines for young infants and children aged 6 months to 4 years. This is super exciting, especially for those of us that are parents of young children in the country. It's about 18 million children in this age group that are newly eligible for the vaccine. And I can say from a personal standpoint, this is going to be so helpful in easing the anxiety, decision fatigue around keeping our kids safe. So for myself, I have a baby. He just turned 1 year old. And so I've been really looking forward to getting him vaccinated after myself getting my first 2 vaccines while I was pregnant at Natividad, and then my booster while I was breastfeeding. So in terms of the background, and why the biggest reasons that I recommend to families the vaccine, here's my cat, she's also a proponent, as I've recommended for the kiddos age 5 and up thus far, is first of all, to the fact that COVID does make kids sick. I think sometimes there's this perception that kids don't get as sick from COVID, but the reality is, since the pandemic, we've had about at least 2 million young children contract COVID since the beginning of the pandemic, and 400 young children, again, in this age group that's newly eligible, have passed away from COVID. So it's a very real threat. Those numbers, especially of infection, might even be an underestimate based on home testing, which might not get reported. And in fact, actually recently with new subvariants and surges of, for example, Omicron, we've actually seen that kids have higher rates of hospitalization. So the CDC released a report in February around looking at the peak of the Omicron variant, comparing it to the peak of the Delta variant, and found that especially kids in this young age group under 5 years old had rates of hospitalization of 5 times that of the rates of hospitalization of the same age group during the Delta variant. And this holds true in my experience as a pediatric hospitalist, meaning someone that takes care of kids admitted to the hospital. In recent months, I've actually seen more kids actually being sick enough to be admitted with COVID, and those almost uniformly have been very young, under age 5, and some small babies as well. So that's one reason that I'm excited to recommend this vaccine to families. Another reason is, even for those kids that do have mild illness with COVID, they are at risk for long-term complications, including long COVID, which we're still trying to understand. And for me, again, as a hospital doctor for kids, most importantly is multi-system inflammatory syndrome of children, MISC. So this is a phenomenon that we've seen happen in kiddos that had a recent infection with COVID. Many did not have any symptoms or only had mild symptoms, and then they present with rapidly progressing multi-organ failure, as well as myocarditis. So that's inflammation of the heart that can make it not function well, even give a heart attack. So that's a very serious and real risk that we've seen in children. And in fact, As far as MIS-C cases in the country, that we know, at least about 8,000 kids have gotten it, and 68 of those have died. So that's one of the reasons when parents ask me, well, why should I do this? For me, having sort of been familiar with and knowing colleagues who have treated this really life-threatening condition, to me, that's a big motivating factor. And I'll talk about that risk as compared to risks and concerns around the vaccine itself. So as far as what the vaccine will look like, we have the two options of Moderna and Pfizer for kids in the 6-month through age 4 years group. So for Pfizer, it will be right now 3 doses. Those first 2 doses are 3 weeks apart, and a third dose will be at least 2 months after. And then Moderna is going to be, for now, 2 doses, 4 weeks apart. They are studying a third dose, a booster essentially, and in particular, the looking at that protection of a third dose against Omicron, which is what the Pfizer trials showed, that they added that third dose, recommended it to improve protection against the Omicron variant. So as far as effectiveness of these vaccines, so kids in this age group are going to get very similar protection to those kids in the age 5 through 18 age group. So it's most importantly effective in preventing serious illness, hospitalization, and those long-term effects that I mentioned. So as far as the actual numbers, I will say broadly, just that there's better protection, longer lasting protection, and more broad protection in terms of subvariants with the vaccines as compared to historical infection with COVID in kids as with everyone else. So hopefully that clarifies things for parents that are trying to decide what to do because they know their kid had COVID, and is that enough? And the answer is no, it's not. They get better protection when they get the vaccine. And we know this based on comparing in these trials, kids who had history of known infection and those who didn't. Now, as far as safety, because of course, every parent wants their kids to be safe. They don't want to subject their child to any kind of risky intervention without, adequate safety studies. So the safety studies have been very rigorous from both Moderna and Pfizer. Thousands of children, were studied. And essentially what it comes down to, and this is why we have all these different bodies, the FDA, the CDC, American Academy of Pediatrics, our local Western State Scientific Safety Review, all looked and felt comfortable that essentially the side effects are very similar, comparable to that of the side effects from other routine vaccinations that we've given for years. So most commonly, pain, swelling, redness at the injection site is going to be the most common. Fever. We call it malaise. So general fatigue, maybe muscle aches in little babies who can't tell you that's happening, might look fussy. And generally those symptoms are 1 to 2 days and then they resolve. As far as serious adverse reactions in the studies so far, which we still need more data, of course, but in the thousands of kids that we've looked at in these studies, there were no severe allergic reactions and there were no cases of myocarditis and pericarditis. Now, I know there have been concerns in particularly in young adult men who received both Pfizer and Moderna vaccines for myocarditis. And I've had some parents ask me about that risk, weighing that risk for their children. And again, the reality is, so far in this young age group, we have not seen that happen with the vaccines, whereas we have absolutely seen myocarditis, pericarditis, essentially inflammation, dysfunction in the heart from COVID itself. So the risk is much greater from the data that we have in contracting myocarditis from COVID itself than from getting the vaccine, which is one thing I talk about with parents. As far as resources for parents who are ready to get their kid vaccinated, give them that maximum protection, we need a little time from my last checks on getting the actual doses in the hands of distributors here locally and throughout the country, really, because part of the reason for that is because, and another reason the studies took a while is they've found the minimum effective doses that are the safest for kids. So for Pfizer, it's about 1/10 of the adult dose. Moderna, it's about 1/4 of the adult dose. So, they needed to produce those vaccines for pre-orders, and we need to get them to people that can distribute them. So stay tuned. Your best resources will be your child's primary care provider. And of course, the county of Monterey has been excellent, has its own, avenues for distributing the vaccines to everyone who is eligible and wants them. So I know we might be hearing from that even today from some of our health department colleagues as to what to expect timing wise in terms of getting these vaccines to our kiddos here in the county.
May I believe you're on mute?
Thank you for calling me out on that. Thank you very much for walking us through this. I know parents have questions. If my children were of this age group, I would have the very same questions that you were answering. If anyone has questions for Dr. Sakai, please go ahead and put them in chat. I do want to ask you, one thing that was discussed about this vaccine was that there might not be the initial rush to get it. Parents may hold back. Are you hearing the same thing among your parents and patients?
Oh, yes, for sure. And I have to say, it's understandable. Like I said, all of us as parents, caregivers, and providers for young children just want them to be safe, want to be sure that we're doing the right thing for them. And, the data shows that nationally, we, as a, comparing our more than 23 million kids age 5 to 17 years that have gotten at least one dose, we have another 26 million that have gotten no doses. So that speaks to that hesitancy. Here in the county, similarly, we're working on these rates from when I last checked of about, I believe, 39% of our kiddos age 5 to 11 who have had at least one dose here in the county. And, again, I just encourage parents to ask questions, reach out, especially to their pediatric provider. And, we're here to give you all the information you need and help you feel comfortable for whenever you're ready to offer this, excellent protection for your child.
Thank you very much, Dr. Sakai, for giving us all this information and sharing your experience with having your own children that you can't wait to get vaccinated as well.
Absolutely. Happy to be here. Thanks so much.
Thank you. And now we've got who I introduced earlier, Kristy Michie from Public Health from the Monterey County Health Department. She is here to answer your COVID-19 information questions. And also, I think, Kristy, you've got some information about updating the website and a new way that COVID information is going to be shared.
Yes, thank you very much for having me. I'm Kristy Michie, the Assistant Director of Public Health here at the Health Department. And I'll just start briefly with some changes, as Maya mentioned, that are going to be happening to our website tomorrow, particularly our COVID-19 data website. So as you know, we have a new population of Monterey County residents that is eligible for the COVID-19 vaccine. That means that when we calculate the proportion of individuals who have received one dose of vaccine or two doses of vaccine in Monterey County, the number we use as the denominator, the county population of eligible population, is now going to increase by about 30,000 children. So that number will be added into our denominator, and it will adjust the overall proportion of residents who have been eligible for vaccine and have received those doses. Those numbers will change just because we're changing our denominator. The other thing that we're updating with our denominator is that we're using an updated version of the California Department of Finance population estimates. And this new version is based on the 2020 census. The data we have been using in the past was based on the 2010 census because that was the most recently available at that time. So this shift will cause some changes in the proportions of age groups and demographic groups that have received a vaccination because has been a shift in certain populations over that 10-year span. So it has nothing to do with the proportion of people, the actual number of people who are vaccinated, but the proportion will change because of the way we're calculating it and the denominators files that we're using to make those calculations. The other thing that we're really excited to bring online is that on our vaccination page, there is a tab for individuals who have received one dose of vaccine. There's a tab for 2 doses of vaccine, shows that information broken down by demographic groups. Starting tomorrow, we'll be adding the proportion who are eligible for a booster dose and have received that by demographic groups. So that's a new set of data that we'll be sharing with the the public. And so we're excited to have that rolling online tomorrow. The last change we'll be making is that we have a little bit of a summary dashboard that has like our rates per 100,000, our test positivity, hospitalizations, and then it also lists the proportion of Monterey County residents who have received 1 dose of vaccine. We're going to be changing that out and swapping it in with 2 doses of vaccine, and that just really reflects the importance of completing the primary series and our emphasis on making sure Monterey County residents know how important it is to get vaccinated. So that shift will be happening tomorrow as well. And I think those are the changes I have on the website. I would like to just mention briefly a couple of other things. And the first is just to kind of give you a status of where we are here in Monterey County in terms of case rates. Our case rates and test positivity do continue to increase. The overall trend is an increasing trend. However, the rate of rise of that trend has slowed down quite a bit. That's good news. It's still important for everybody to take measures to prevent COVID-19, such as getting vaccinated. And Dr. Sakai did a beautiful job of explaining why it's important to get our little ones vaccinated now that they're eligible. But another important protective measure is to wear face coverings when in public in indoor crowded settings. That helps both reduce transmission, and if you're wearing a very tightly fitting, filtrating mask, it can also prevent you from getting infected. Other things like testing are still important. Please consider getting tested before and after large gatherings. Before and after travel is really important as well. These things are essential for us to consider as layers of protection as we are in this period of increased transmission of COVID-19 in Monterey County. The last little bit of information I'd like to share with you, as Dr. Sakai mentioned, while the children are eligible right now, younger children are eligible right now, vaccine is just now being shipped to locations across the county and across the country as well. And while we don't have vaccine ready in our refrigerators and freezers right now in Monterey County, that will soon happen, and we will be sure to let you know as soon as we have that vaccine available and can schedule or have walk-ins for the under 5 group in our clinics. That's not happening yet. We're not ready yet for that to happen. We're anticipating that those ancillary supplies and vaccines will be ready soon, but again, just stay tuned. We're hoping to have an announcement for when that first clinic will be later this week. And Amanda, I think that's all the information I have to share. I'd be happy to take any questions that folks may have.
Great. And thanks very much for walking everyone through the new webpage, because it's, there are people who check it every day, and, a big change like that, people would, wonder, where's my information? So if there's anyone that has questions for Kristy, go ahead and put them in chat. You talked about the vaccine being shipped, and it would be hard to estimate when we could get it, because I think people may think, a couple days, but we really don't know. Would that be fair to say?
Well, we've been given a 1-week window. So the information we received was that the expected time to arrive was anytime between tomorrow and next Wednesday. So it just depends on how the shipping process goes. Hopefully we'll get it sooner rather than later. We're all anxious to get this extra layer of protection out to our community.
Thank you. And so I do have one question for you, Kristy. What is the reason for delay in pediatric vaccine supplies locally? Are these delays shared by other counties across California? Are other counties experiencing the same, wait in shipping?
Well, I'd have to say I don't consider it really a delay. The vaccine was just approved for use over the weekend. Monday was a holiday. So the shipping, agencies and manufacturers, all of that process started on Tuesday. So I think this is just the normal process of vaccine. It's actually very quick to get the vaccine moving this fast following the approval. So I would say that I think everyone in California and across the nation is in the same situation. We're all excited to get the vaccine as soon as it arrives.
Thank you. Thanks very much for explaining that. I know a lot of people are anxious, so I think letting everyone know that we will let them know as soon as we have it in hand is very helpful. All right, we are going to move on to thank you very much. Oh, so I do have a question for you, Kristy. Before I let you go, a follow-up question. When supplies do arrive, where can parents book appointments? Where should they be looking for those appointments?
That's a great question, and thank you for asking that. As Dr. Sakai mentioned, the first place to check is with your pediatrician's office, your local, your child's doctor's office. Many doctors' offices will be providing vaccine to their patients in the clinic where they normally seek their care. So contact your pediatrician and see if they are taking appointments to vaccinate in their office. There will be some pharmacies that will be receiving vaccinations. So you could check with your local pharmacy to see if they'll be offering the vaccine. Of course, there's always the MyTurn website, so myturn.ca.gov, that you can go to register for an appointment, see what appointments are available around you. You go in, you put in your zip code, and it'll tell you a range of, within so many miles of what clinics are available, what types of vaccine they're offering, and to what age groups. That's a great way to schedule your appointment or see what clinics are accepting walk-ins. On our website, there's also a list by region of Monterey County of what vaccine clinics are available with the same information, what vaccines are being offered, what age group, whether it's for walk-in or require an appointment. So I think really our website when you click on that vaccination information page, is kind of your one-stop shop for parents after you've checked your pediatric office.
All right. Thank you very much, Kristy, for walking us through everything, including how to get an appointment. And so we're very pleased to have Mary Zeeb, who is our treasurer tax collector, with us today. She made a very exciting announcement at the end of the board meeting yesterday about a property tax relief program that she was really part of helping make happen. And people think that the financial stress or stress of COVID is over, but there are still leftover needs that people have, and now they have opportunities for property tax relief. So Mary, thank you very much for joining us, and tell us a little bit about this program and how it works.
Absolutely. Thank you, Maya, for having me today. So I was pleased to announce a new property tax assistance program that grants eligible homeowners up to $20,000 to pay delinquent property taxes. So a little bit of backstory on the program. So about a year ago, we started to see COVID relief for businesses. We saw it for renters, and we saw it for homeowners with mortgages. But we also identified a population that could benefit from relief, but that population hadn't been addressed. And that was homeowners that no longer had mortgages. For example, a lot of our elderly have already paid off their home mortgage and didn't have that. Or even homeowners who, above all odds, were able to keep their mortgages current. They were not included in any of the relief programs. So in January of this year, I, along with 4 other treasure tax collectors in the state, began working with the Cal HFA Homeowner Relief Corporation to expand a program they just launched called the California Mortgage Relief Program. And we wanted to include a property tax component. So we worked on that for several months, and the program went live last week. And what that means is that all property owners in Monterey County and the rest of the state can apply for up to $20,000 to pay for any property tax arrearages. And the funds don't have to be paid back, which is fabulous. I've never in all my years seen anything like that. So if I could, I'm going to try and put up a little graphic here as I discuss some of the eligibility requirements. And
we see that.
Okay, perfect. So what that means, of course, there are eligibility requirements. Any individual that was delinquent on property taxes before May 31st of this year and is currently past due is eligible. They have to have had a pandemic-related financial hardship. And I think there's kind of a low bar as far as that's concerned. We're looking at a reduction in income or an increase in household expenses. And I'm pretty sure everybody on this call could probably say they've had one of those as far as being related to the pandemic. There is a household income limit, and it's at 150% of the county's area median income based on federal limits. And you have to own and occupy a single family home, condo, or permanently affixed manufactured home. So my office has already sent notices out to our delinquent taxpayers about this program. And we're working like we are today on extended outreach to the community and our partners that can help disseminate this information to our residents. The program is completely managed by Cal HFA, but we are working closely with them to verify tax amounts and identify any taxpayers that may be able to meet the requirements and help taxpayers, if needed, apply. I think the program is going to move very quickly, and so there's a fairly easy process to go through and a quick resolution of property tax delinquencies. As you can see on the graphic, taxpayers can apply online at camortgagerelief.org, or they can call 1-888-840-2594 to get a little more help. And as always, my office is available to assist taxpayers or direct them however we can. The funding for this program is ARPA funding, and it will be dispersed on a first come, first served basis. So I want to strongly encourage individuals who think that they may qualify to apply as soon as possible.
And I think the key word here is if you think you might be eligible, people may think, oh, I'm not sure what my income percentage is. I don't know what that means. I think if people would you recommend that people take a look at this and really consider applying? Don't just immediately think they wouldn't be eligible.
Oh, absolutely. There's a very easy process going on the website. You answer 5 or 6 basic questions, and there's an initial screening to see if you qualify. And if that's the case, you go on to the next part of the process. But it's fairly easy to determine very quickly whether or not that's going to work for you.
All right. Thank you very much. And how was it being a part of this? Because you were part of this group that pulled this together. It was really very proactive. People stay very focused on mortgages, people struggling with their mortgage, but they forget about that other payment that you have to make twice a year for property tax.
Yeah, it was a challenge for individuals. I think we're fortunate. We have a lot of resources in this area, and a lot of people were able to find the resources to keep their property tax payments current. But there's always a group that doesn't have the ability to do that. So this program can help that group because they were kind of left out of the process.
All right. Thanks very much for walking us through that. And I know we can get information online, and we hope that people will take the time to check their eligibility, and maybe they might be pleasantly surprised that they would be eligible for this assistance.
Great. Thank you so much. Appreciate it.
Thank you. And then if I could get you to stop sharing your screen. Although very nice graphic.
My meeting. I am working on it.
All right, I'll let you do that. And just a reminder, while everyone's looking at that, first come, first serve. So don't wait if you think you're eligible.
Yeah, sorry about that. My computer's locked up, so I'm going to have to leave the meeting, and that'll probably do that.
Thank you, Mary, very much for sharing this information.
Okay, thanks, Maya.
And thank you, everyone, for joining us on the briefing for this week. We appreciate your time, and we hope the information was helpful. Our next news briefing is next week, and we'll see you then.